implant system from Cybermed, an old Korean company actually. And my answer would be the ease of use. It is very user-friendly, actually surgeon-friendly, and both beginner and experienced surgeons can do it easily. And the satisfaction after the surgery is the most important part for me. Well, orally, patients need teeth using for grinding, eating, chewing, and etc. And Core1 perfectly does that role in human mouth. Durability plus a short time of healing and no bone loss actually makes an ideal composition for a patient in real-term use. Fresh socket surgeries, everyday a struggle for surgeon actually. In Core1 system, the double-bladed sharp blades makes it very easy to use in actually non-drilled or even over-drilled portions of the fresh socket implantation. That gives us a very strong capability of first-day surgery, which makes it very easier to use in any kind of socket actually, both posterior and anterior teeth. And what I like the most is the initial stability, which is compared to lots of successful European and American implant systems. Implant system websites, well, we daily read them, visit them, and etc. But what makes Core1 special is that you don't need to visit their website actually, because the implant talks for itself, and the high success rate of the implantation with the Core1 system, and very low bone loss compared to lots of Korean implant systems, not all but lots of them, makes it a great choice for patients and surgeons. I attach to the portion that you ask in my experience. Well, I'm generally a cover screw guy. I actually attach cover screw in every surgery. I don't like using healing in first steps of surgery, but for some example cases. Given an idea about the success rate of an implant system as a wide range of compositions, which needs lots of clinical trials, articles, and lots of experience using for years and years on this system. But in my idea, the Core1 system is the only system between lots of others which is available in my country, in my region, that I drill with confidence, I insert with confidence, and I load it with confidence. And this system gives me no problems in both surgery and prosthetics, and I'm not afraid of implantation anymore. Using Core1 system, you can do it confidently. Experienced surgeons find their way in finding out new implant systems. Even lots of them do it by looking at post-op series graphics of the implants, attachment loss, bone loss in first few weeks, first few months, and first year actually. And they can find it well. But for beginners, if you want to do an implant system that encourages you to just do implantation in your office, I believe the best choice, or at least one of the best choice for implantation, is the Core1 system from Cybermed, because you have very few challenges doing the surgeries and post-op problems after the surgeries actually. In comparison with the general systems, dental implant systems, well, Core1 can find its ways in lots of markets, especially European and American markets. I believe that it hasn't been known in lots of countries due to the distribution, but that's a misfortune for surgeons actually in their countries. But I expect the company to work on lots of other systems in ahead of the future of these Cybermed dental implants, which is SLA active systems, osteo active systems, and a little bit differences in designs, which makes me no need for other dental implant systems in my dental office actually. Core1 system can provide lots of range of patients treatments, but not all at the time of the we were speaking. But I believe someday I would say I wish I was an investor in the Cybermed company. I believe I can call it a good virus. Core1 system is like a virus, can spread longly among surgeons. As a surgeon and as a dentist, I'm not an investor, and my only investment is my bank account. But I believe that investing in kind of successful dental implant system, which hasn't been known in lots of countries so far, is a gold mine. I myself believe that implants, they have to find their way, and Core1, at least in my country, has done it successfully, because I recommend it to lots of my friends, and lots of those friends just recommend it to other friends, and there is a high society of dentists which are using the Core1 system in a very short period of time, and we love it.